name's Dr. Molly Hart, and I am the owner of Pelvic Balance Physical Therapy. So I am a women's pelvic health physical therapist, and what that means is I specialize in treating females who have pelvic floor health concerns in general. A lot of the times people will ask me what got me into this field and why am I so passionate about it. And to be honest with you, I never anticipated that I would be here right now doing what I'm doing, but very much so I believe I was spiritually led down this pathway to be here, and I just kind of followed it, and I'm still following it. And I think that there's a strong reason behind that. So when I was an undergrad, I knew that I wanted to be a physical therapist already. I didn't know really a ton about the different specialties in physical therapy. I just knew I wanted to be in this field because I've seen it help so many people, even in my own family and elsewise. So as I was an undergrad, unfortunately, my mom was diagnosed with breast cancer. And because of the school I was attending, Moffitt Cancer Center was right nearby, and I decided to go to a majority of her sessions with her. And during this time, I realized that our medical system is not in any way what I ever thought it was. And it was disheartening. I was honestly mind blown by how they operated in general, and how my mom was treated was absolutely appalling to me. So during a lot of her sessions, she was completely, I would say, just ignored, not really fully listened to. And often my mom would ask for things and just was ignored, and she would cry after the sessions or even during the sessions because of feeling just like another patient and not like an actual person. My mom's an extremely strong person, so to see her be treated that way and to see her go through that was heartbreaking for me. Step forward, we find out that she has the BRCA2 gene, which means that you're highly predisposed to having breast and ovarian cancer in the future. You have an increased risk of getting that. So I got genetically tested to see if I have it. And unfortunately, I found out I do have the BRCA2 gene. And ironically, the way I found out was I went and got tested. I was told that was stupid for me to go get tested in the first place by a doctor. And then when I got my test results, it was the front office person who called me. And I'll never forget, because I was in grad school at this time and I was studying. I got a phone call and they said, hey Miss Knight, we got your test results in and you do have the BRCA2 gene. And that was it. So that's how I was told, which is, when I look back on that, I took it very well. I kind of had a feeling just because I'm so much like my mom. But to think that that's how I was told that news is kind of heartbreaking. So from there I went and did genetic counseling, and with genetic counseling, I was informed that what they're advising is for somebody like me to do IVF in the future when I have children, to select out for the gene so I don't pass it on, to do a double mastectomy so I get rid of both my breasts, and then to do a total hysterectomy, so completely removing my uterus and my ovaries. And I wasn't okay with that. I really just wasn't okay with the idea of essentially chopping off my female body parts as a preventative way. I was like, there has to be another way. So I start looking more into the conservative care to figure out what can you do to prevent cancer risk when you have a gene that makes you more predisposed. So I started doing the research, and I realized that there's so much conservative care we can do via the food that we eat, via decreasing environmental toxins, exercising, self-education, self-care, keeping your stress levels down, which is one of the most important things, I would say. And so as I started learning all of this, I became very passionate about women's health, and I realized that women are so medically mismanaged and mistreated in our medical system. And I also know and firmly believe that surgery should be an absolute last option with the majority of things, and really should not, in my opinion, be used as a preventative measure. And often it shouldn't be used to treat chronic pain because it doesn't work very well, and often it makes people worse, but yet we're still practicing this way. So my very first year of being a PT, I infiltrated myself in the pelvic health world and learned as much as I possibly could about this. I had mentorship, and it was amazing what I was able to learn, but it was also, again, heartbreaking. So I had female after female come into my office. They've been dealing with chronic pelvic pain conditions such as endometriosis, IC, painful bladder syndrome, where it feels like you always have a UTI. Women who had a lot of pain with intercourse, which is called like vulvodynia, vaginismus, dyspareunia. Those are all different diagnoses they'll give you. So these women have been dealing with these chronic pain conditions for 5, 10, 15 years. Often they've been on medications to manage it and have had multiple surgeries to try to correct this, often only getting worse after majority of the surgeries. And now coming finally to pelvic PT because a doctor finally recommended to them that they should go see a pelvic health PT. So what I realized when I was going through all the research and learning all of this is that research shows clearly that pelvic health PT works extremely effectively, and it's one of the first line treatments for majority of chronic pelvic pain conditions. Yet it's not the first treatment that's ever offered, and most people aren't even told about it. Most women don't even know about it. So after about a year of doing this, I decided, after I took a course and I came back from that course, and I just had a strong calling, and I realized I have to quit my job and I have to go out and educate women about what is happening and preventing them from getting these surgeries, preventing them from getting on all of these medications, and understanding that seeing a pelvic health physical therapist is one of the first things they should be doing to address their pain issues. So I am doing this video right now, and I started up my business because I want for us women to help educate each other and to teach each other about what we can do conservatively for our bodies to help us have a long, healthy quality of life and to be protected. I truly believe that we should be staying away from surgery, and if you look at the research, it supports that as well. If you look at high quality studies, systematic reviews, meta-analyses, most of the time, the first and second line treatment that they're recommending is pelvic health PT, yet it's not being recommended by a lot of physicians. So women, please help me share this video, share knowledge with your friends. If you know that they happen to be suffering with any types of conditions down here, if they feel like they have chronic or constant UTI type symptoms, or a lot of abdominal cramping and pain, or really hard time with bowel movements, really hard time having intercourse with their partner, or even just with a tampon insertion. These things are stuff that we can absolutely address conservatively with pelvic health PT. And if we can do it first with conservative care and try to avoid the medication and the injections and the procedures and the surgeries, that is going to lead to the most optimal health outcome for us women. So thank you guys for listening. Please share this video out, and let's help each other to be educated and to understand what we can do to protect our beautiful female bodies. Thank you so much.